A serious problem. Personal medical debt is really mounting for some patients in our state. If they can't pay, that's when the debt collector calls start. Good evening, I'm Kelly Swoop. Jamie has the night off. You may have gotten some of those threatening calls. A new study shows that a large portion of those patients come from low-income communities and are often people of color. Well, now there is a push to better protect patients from medical debt lawsuits. WMAR2 News' Dave Detling takes a look at the legislation that is already in the works.
There is a package of bills in the works in Annapolis today. The message to medical debt collectors from some healthcare workers: stop targeting our low-income patients.
Healthcare should be a right for everybody and not a privilege for those who can afford it.
Baltimore City registered nurse Josh Pickett sees patients making tough medical care decisions every day. If they're low income with little to no insurance, payment is a problem.
You see patients struggling with rationing their medications because of the cost of their medical bills, as well as the medications that they're prescribed, as well as just necessities that they have to get, such as food, housing, taking care of their children.
If they can't pay, that's when hospital debt collectors start calling. The Maryland Consumer Rights Coalition says most patients targeted are low income and people of color.
The median amount of money they're collecting is $944. So these aren't people who owe hundreds of thousands of dollars. These are people who owe $1,000 and they can't pay it. And then they're taking those people to court.
Lawmakers say the state's medical debt collection culture needs to change. One bill in the works would require hospitals to ensure eligible patients get assistance before lawsuits are filed. There's also a push to allow hospitals to charge all patients more under the state's strict rate-setting system to cover more charity cases. Another bill would prohibit suits for $5,000 or less and stop liens on patients' homes, allowing for affordable repayment plans.
What we're saying today is, let's talk about the ways that you can do that debt collection. Let's talk about the ways that you can do those things that are protective of our consumers and that are still allow the hospitals to be financially solvent.
It's a moral catastrophe for our state, and it's a fiscal problem for our healthcare system.
National Nurses United, some doctors, and community activists are backing these bills, Pickett included. He's hoping for bipartisan support for his patients' sake.
There needs to be an absolute reform across the board.
And the bills have to go through their respective committees and a series of hearings before making it to the governor's desk.